Good afternoon, everyone. My name is Roslyn Martel from DS1B. And before we start, I prepare all the materials that I'm going to use in the written demonstration for the assessment of mouth, oropharynx, and neck, which are the globs, tongue depressor, gauze pad, and pen light. Now we are going to identify our client. How are you today, ma'am? I am Roslyn Martel, your student nurse for today. Ma'am, can you tell me your name?
My Killing.
And how about your date of birth?
May 12, 2006.
How would you like to call you, ma'am?
Just call me Ma'am po.
Okay, thank you, ma'am. So, ma'am, I am here to perform an assessment to your mouth, oropharynx, and neck to identify if there is any mucous membrane to your lips, mouth, or dental hygiene, and also to identify if there is any abnormalities. Rest assured, ma'am, that all the document I'll be noting is confidential between us and the physician that I'll be referring to you. Is that okay, ma'am?
Yes po.
Okay, assume that I have properly washed my hand to stop or prevent the cross-contamination. And I'm going to give and provide client privacy for setting the curtains. Okay, ma'am, before we start, let me ask you some questions. Is that okay with you, ma'am? Are you comfortable with your position?
Yes po.
Okay, while wearing my gloves, ma'am, do you have a routine for your dental care?
Just brushing my teeth 3 times a day.
When is the last time you visit your dentist?
Last month.
Any lesion present?
No po.
Do you wear any denture?
No po.
Any medication right now, ma'am?
No po.
Okay, thank you for that information, ma'am. Now we are going to proceed for the inspection of your lips for the symmetry of your contour, color, and texture. Ma'am, can you purse your lips as if you're going to whistle? While inspecting, the color and the texture are normal and the contour is symmetry. Now we are going to inspect and palpate the inner lips and the buccal mucosa for the color, texture, moisture, and any presence of lesion by using the tongue depressor and pen light. And we're going also to inspect the teeth and the gum. Ma'am, can you open your mouth? Upon inspecting, the buccal mucosa is uniformly moist. The color, the texture are normal, and there is no presence of lesion. And also, there is no missing or broken tooth. And if the client is wearing denture, you can ask the client to remove completely so that you can inspect the condition and note any particular broken. Okay, ma'am, we're going to inspect the structure of your tongue for the position, color, movement, the base of your tongue, the floor of your mouth, and the frenulum. Ma'am, can you protrude your tongue? Can you roll upward? How about downward, ma'am? The right side and left side, ma'am. Okay, ma'am, thank you. Upon inspecting, the tongue can move freely and there is no abnormalities. Now we are going to palpate the tongue, the floor of the mouth, for any nodules or lumps. Using the gauze pad, grabs the tip of the tongue of the patient. Using the index, we're going to palpate the back of the tongue, the base, and the border. Upon palpating, there is no sign of nodules and the prominent vein are smooth. Okay, ma'am, now we are going to inspect the salivary duct opening for any swelling or redness. Ma'am, can you open your mouth and roll your tongue to the roof of your mouth? Upon inspecting, there is no sign of swelling and the color are the same with the buccal mucosa. So ma'am, now we're going to inspect the hard and the soft palate for the color, shape, texture, and any presence of bony prominence. And also, we're going to inspect the uvula for the position and the mobility using the tongue depressor and pen light. Ma'am, can you tilt your head and open your mouth? Can you say ah? So upon inspecting, the soft palate is pink and the hard palate has a regular texture. And the uvula of my client is positioned in the midline of the soft palate. Now, ma'am, we're going to inspect the oropharynx and the tonsil for the color, texture, discharge, and size. Using the pen light and tongue depressor, ma'am, can you tilt your head and open your mouth? Upon inspecting, the tonsil is pink and the texture are smooth and there is no discharge and the size are normal. So now we are going to elicit the gag reflex using the tongue depressor and the pen light. We're going to press the posterior of the tongue. Ma'am, can you open your head and open your mouth? So, upon elicit, the gag reflex is intact and we're going to document the findings in the client record. Now, we are done assessing your mouth and oropharynx. Now, I'm going to assess your neck to determine if there is any currently experiencing or any symptoms or previous medical history related to the neck issues. Ma'am, do you have any question before we proceed?
No.
Are you okay with that position? Are you comfortable?
Yes.
Okay, ma'am. Ma'am, now I'm going to change my gloves for a new one. And before that, let me ask you some question. Is that okay with you, ma'am?
Yes.
So, ma'am, do you have any problem with your neck lumps?
None po.
Do you have any treatment like surgery or radiation?
None po.
Any previous diagnosis?
No po.
Do you feel pain in your neck or stiffness?
None po.
Okay, ma'am, thank you for that information. Now, I'm going to inspect your neck muscle for the abnormal swelling and masses. Ma'am, can you hold your head erect? Upon inspecting, the neck muscle is equally sized and the head is centered. So, ma'am, now I'm going to observe your head movement. Ma'am, can you move your chin to your chest? Can you move your head to upward? How about, ma'am, can you move your head towards to your shoulder, both sides? Can you turn your head left and right? Thank you, ma'am. Upon inspecting, it is coordinated and it smooth the movement and there is no discomfort. Now, I'm going to assess your muscle strength. Ma'am, can you turn your head and resist my hand? So, ma'am, can you shrug your shoulder and resist my hand? So, upon assessing, there is a strength of my client muscle and the jugular vein is not distended. So, now I'm going to palpate the entire neck for the large lymph nodes. Preauricular, the postauricular, occipital, parotid, digastric, the submandibular, the submental, the superficial cervical, the cervical chain, the posterior cervical. So, upon palpating, there is no sign of enlargement of the lymph node of my client. So now, okay, now ma'am, I'm going to palpate your trachea. Using the fingertips or the thumbs, I'm going to place on the trachea. Ma'am, can you deep breath? Thank you, ma'am. So, after palpating the trachea, it is placed on the central midline of the neck. Now, I'm going to inspect the thyroid gland. Ma'am, can you drink and swallow? So, upon inspecting, the thyroid gland is not visible on inspection. So, ma'am, I'm going to palpate your thyroid gland for smoothness and note if there's any area of enlargement, masses, and nodules. When palpating, there are two ways of palpating the thyroid gland, the posterior and the anterior approach. In the posterior approach, you go behind to the patient. So, ma'am, can you bend your head forward slightly and relax your muscle neck? Using your finger, push to the slightly to the trachea. Ma'am, can you swallow? Thank you, ma'am. And for the posterior, standing facing to the client. And using the thumb and the finger, hook to the sternomastoid. Ma'am, can you swallow? Thank you, ma'am. Upon palpating, there is no noted nodule, no masses, no suspected masses, and there is no enlargement in the thyroid gland. But if you feel any enlargement on the thyroid, you can auscultate the area using the bell of your stethoscope. So, ma'am, thank you for cooperating. After that, we're going to document all the information and refer for further evaluation.